So we are the NoPain group. I'm Lindsay, this is Kush and Boshidar, and we're going to talk to you today about an app that we created to assist adolescents and young adults with self-managing pain. So first, just to talk about pain a bit. Oh my gosh. There we go. Just to talk about pain a bit in general, chronic or recurrent physical pain affects 25 to 35% of adolescents and young adults, and it can result from either a disease, so things like arthritis or cancer, or it can result from an unknown cause. And we also know that if left untreated, this pain results in several problems, including high distress ratings, social and mental health problems, poor academic performance, and also increased utilization of healthcare services. And we additionally know that despite advancements in the amount and quality of pain management research, pain in young people continues to be poorly managed and is a problem. So one strategy to help adolescents and young adults deal with chronic and recurrent pain is through self-management. And self-management has been defined as an individual's ability to manage the symptoms, treatment, physical and psychological consequences, and lifestyle changes inherent in living with a chronic condition, for instance, pain. And self-management programming typically includes disease and symptom education, provision of social support, goal setting, and also personal reflection and decision-making support. And these different components we've looked at closely and incorporated into our app. They're typically most effective when delivered multimodally, and that's what we've done. And we also know that the acceptability and accessibility of this important self-management programming can be improved if it's delivered via smartphone technology. So that brings us to our app, which is the NoPain app. And the goal of our project then is to design a smartphone-based application that will aid adolescents and young adults in self-managing chronic and recurrent pain. So here is a high-level block diagram of our app. So if you look first at the center screen, you can see that we have several different functionalities stemming from there. We have, firstly, and probably most importantly, our pain survey and recommendations functionality. So the app will alert adolescents and young adults every 12 hours to complete a pain survey. They can also go in and enter one when they want, when they're in pain. Based on their survey results, it'll give them a recommendation, and then it'll ask them in an hour how they liked that recommendation. It will reassess their pain and make another recommendation based on their pain at that time. There's also a tracking calendar so they can see when surveys are coming up, and also enter, say, appointments, or if they know that they're going to have an upcoming painful procedure, they can add that and plan for that. We have a journal where they can enter information that they want to reflect on about their pain experience. There's also goal setting, meant to increase feelings of self-efficacy and power over controlling one's pain. And we have that linked also with social support, so that goals can be communicated with friends and others. And then there is also disease education here, with modules that I've created about pain conditions and pain in general. And then we have settings so that disease education is made specific to a pain condition.
So now we'll jump right into the demo. You can hear, I have the app preloaded on the phone. It's, we have some surveys preloaded. Basically, when the user comes here, they can register with the username, so we'll go with the shortest possible for time constraints. So they register and then they log into our app. This screen presents them with several options. They can either take a survey, which I'll do right now. So the first question asks them is whether they have pain. They've had pain in the last 12 hours, and we'll answer yes. Do you have pain now? We'll answer yes. If they answer no to either one of these questions, then they do not proceed ahead with the survey because they haven't had pain or they don't have it now. This question, I'll quickly go through it, but these questions judge the amount of their pain, how much it influenced their actions in the past 12 hours, how much it interfered with their life. Also, it asks them about some medications which they try to take or other actions which they try to perform and how helpful they were with managing their pain. We store all of these answers locally, and in the future, as Kush will mention, we hope to transfer it to healthcare professionals so they could review this. So after completing the survey, they get a list of recommendations. And because we have some results preloaded, we already have ratings, which are based on how much they liked each recommendation and how well it worked for them. So at this point, I'll choose Learn About Your Disease. And then the next time they take a survey, we could go through the same process. So yes and yes. So we go through a survey. We will probably see that learning about your disease has a higher rating at this point because we said it was helpful. So talk or write about your disease now has 4 stars. It has moved up from the 3 stars it had previously. And these items are ranked based on the stars, so the ones that are more effective for the user are always placed at the top so they could come back to them and help manage their pain more effectively. Other functionalities which we have is integration with the Google Calendar on the device. We can set up recurring reminders about surveys. And these are set up automatically. The user can also add new survey times. So whenever they want to take a survey in, say, 3 hours from now, they can add a reminder. So their phone tells them to log into the app and do the survey. They can also add appointments. So I'll add a new survey. As you can see, it's now displayed on the screen, and then they could, edit it the same as any other appointment in their calendar. They can also add appointments, which is pretty much the same thing, and it shows up on the calendar as well. Press that one too many times. Other functionality which we have is goal setting. So they could, for example, say what they feel and then share it on Facebook or Twitter. We have a journaling option in which they could either enter their feelings in text format or video format, and that's once again used to evaluate their progress and transfer it to a medical professional perhaps at some point. So really quickly, I'll click on Video Journal, which will bring us to the camera app, and I'll record a brief video for class. So at this point, one of these videos should be it. So that is the video of the class, and the user can come back to it at any time and review it. As Lindsay mentioned, we also have health information, so the user can learn about their disease. If they set a disease, for example, right now it's general pain, but if they said it's cancer, and come back, it will display the information that Lindsay provided us, which tells them about their disease, how to manage it, how it affects their life, and so forth. So that's pretty much it for the demo. I'll transfer it now to Kush, who will talk about future steps and Q&A.
Right, so just to quickly finish it off. So the key learnings that we have over this app is obviously the pain algorithm that I worked on. It was very important to take the algorithm in perspective of the users, like what they like more and more into getting into the complexity of the algorithms. Second one that was about the calendar functionality and how we integrate it with our app, which is quite challenging. And what would we have done a little bit differently is to actually go with the functionality first rather than polishing our app, which still needs to be done a little bit more than what is it. For future work, we would like this data that we record locally to be integrated with the Sick centralized database, where the doctors can review them and provide different suggestions to different patients specifically. The usability testing is another thing which we want to be tested by the real users so that they can give us feedbacks on that. Classroom modules, again, for making it more effective use of the app, and review and polishing of the app in a better way. Thanks.
Question. Recalling the previous presentation that you had pain management algorithms. I didn't see those here. Where are they showing up in this?
So those inform the recommendations that are given. So based on the answers that adolescents enter to the questions that Bushra went over, different recommendations that we give.
I see.
So the user chooses the one, and then accordingly we will weigh them up. So they will get a chance to weigh whether they like or dislike,
Yeah.
and accordingly in the list it will go up and down.
So the inputs are both the survey and the things that they liked
Yeah,
previously.
yeah. We
Yeah.
developed a pain management algorithm, but we also wanted to take into account user preferences for recommendations.
So that's why you showed the different ratings.
Yeah,
Okay.
yeah.
And user can't even change that. It cannot go. It was just for the just for the just a show. And then when they like and dislike, the ratings are already adjusted and then back in.
In your report, make sure it's clear,
Yeah.
that this functionality is clear, because I think it's the most essential and novel thing we have going. You can see that.
Yeah. So I noticed that the surveys and sort of treatments recommended are in general, so sort of for pain in general.
Yeah.
Do you think there would be benefits if you make them specific for different conditions that users might have? So for example, for arthritis, we might ask different questions.
So far we've kept them general, and we think that generally pain management strategies that adolescents and young adults can do on their own, independent of their healthcare provider, so independent of, say, prescriptions, medication prescriptions, are pretty general across the board. I mean, there would definitely be specific things, for instance, like exercise as it relates to arthritis and stuff, that where we could tailor it a bit, but so far they're general across the board.
Right, we could move on to further comments.